here is our host, Tian Wei.
Hello and welcome to World Insight. I'm Tian Wei in Beijing. We begin today's program with the worsening coronavirus pandemic. The Chinese mainland has reported over more than 100 daily new coronavirus cases, a big surge since April. Though the number is not huge, it is still worrisome to the Chinese public. The U.S. remains the epicenter, of course, of the world, accounting for over a quarter of the world total. The second and third worst hit countries are Brazil, India. Meanwhile, in some other countries that are earlier, the pandemic was well contained. Now they are encountering a surge in infections, such as Japan and South Korea. Not out of the woods yet, how can nations cope with this peak and valleys of recurring infections? For more, we are joined in Seoul by Dr. Alice Kim Kang-tan, who is an internist at Ms. Medi Women's Hospital. In Tokyo, Professor Koji Wada from Faculty of Medicine from the International University of Health and Welfare. In Nashville, United States, Dr. William Schaffner, Professor of Medicine in the Division of Infectious Diseases at Vanderbilt University School of Medicine. And in New Haven, Mr. Xi Cheng, Associate Professor for Health Policy and Economics from Yale School of Public Health. Wonderful to have four of you and to also see the four of you safe and sound amid the pandemic. Let me start by talking about the situation in China. Mr. Xi Cheng, I'm sure you've been watching it very closely for the very first time since April. The cases confirmed in China have exceeded more than 100, though that number is very small compared to many countries, but to China is already an alert. Mr. Xi Cheng.
Yeah, I think we are still in the time period without effective antiviral drugs or vaccines. So conventional non-pharmaceutical interventions are still very helpful. There's no need to be panicked at this moment because I think with the cumulative experience in Wuhan, in Beijing, and now in Dalian and Xinjiang Uyghur Autonomous Region, I think those conventional health measures still are helpful, like early diagnosis, early report, early isolation, and early treatment. If we can use that efficiently, effectively, we can still curb those flare-up of the virus outbreak. But sometimes we need to be smart in implementing those measures. For example, whether the healthcare sector could be more effective in treating those patients and giving the doctors more incentive, encouraging the patients or potential patients to be having an early diagnosis. That would be very helpful.
Right.
The United States have been discussing this, like how to encourage people to be tested and how to reimburse the doctors for ordering the test and the contact tracing.
Okay. A spike in infections hit Asia, for example, Hong Kong, Vietnam, Japan, South Korea, Australia, if you think about the Asia-Pacific region, all of which seem to have infections reasonably under control recently. Hong Kong races against a wave of new 100 cases a day, while Vietnam had a nude awakening with nearly 36 new cases. Japan had nearly 1,000 on Tuesday, while South Korea posted 48 new infections. In Australia, state of Victoria, authorities announced 295 new cases on Wednesday. These are just some of the latest numbers. We have some of those coming from this part of Asia. For example, Dr. Wada, coming from Japan, tell me more about how Japan is struggling with this new wave of infections. What do you think have been the characteristics of this time?
In April, we have an outbreak, and we have some cases of the COVID in Tokyo as well. And the government has declared a state of emergency in April, and the wave has been controlled. But since early July, gradually the number of patients are increasing, and there are huge disputes between the public health and economy. And now the economy has a very strong pressure for the government. So the government are not able to have the intense interventions for reducing the human contacts to control the number of infectious of the patients of the COVID-19. So we are in the dilemma between how we could control the infectious disease and also maintaining the economic activities. That's the situation in Japan.
That is an ultimate question a lot of economies are facing these days. Also, Dr. Tan, in South Korea, you have waves earlier, mostly under control, and this time another slightly picking up. Are you worried what have been earlier cases help you to understand the current situation?
So currently we're seeing a shift in where the clusters are occurring. Our most recent big cluster was in the city of Gwangju, which is in the southwest corner of our country. It's about 1.5 million in population. And I'm not sure that they were quite ready in terms of the epidemiological support that they needed up front to get on top of the spreading cluster. And I think going forward, that's what Korea and many countries need to do, is we need to have sort of a mobile epidemiological team that can go to the rural or to the non-metropolitan areas, because clusters will emerge in those areas that perhaps were quiet in the beginning stages of the outbreak. Another sort of a blind spot for us, I think, was the seaports of entry. Recently, we've had large numbers of cases from Russian-flagged ships bringing cargo into Korea, and their crew members have infected domestic Korean workers, and also as they have disembarked from their ships, we've discovered that they have been carrying COVID-19 into our country. So it's right now our focus is on controlling what's going on in the outskirts of our country domestically, but also securing our borders and controlling the numbers of imported cases that have been coming in. The numbers of imported cases have outnumbered the domestic cases in the recent weeks.
I see. It's mind-boggling because there are so many things that we still do not know about this virus and the reasons contributing to the latest confirmed cases. If you look at the world, so far more than 16.5 million confirmed cases already, and with more than 650,000 deaths in 216 countries or territories, according to the latest from WHO. More than 4.2 million of those infections are in the United States, with now we already know the number 150,000 deaths reported. Spiking numbers did little to persuading the U.S. president, of course, talking about taking ultraviolet light or disinfectant. Dr. Schaffner, how do you see the next stage? From 1 to 1 million in the U.S., it takes 100 days. From 3 million to 4 million, only 15 days. People are really worried, Dr. Schaffner. I'm sure you do too, especially.
So I'm an optimist, and I'm very worried because we have a serious circumstance, serious conditions in the United States, so very different than the countries of my colleagues on this program. In my country, the virus is out of control. There is no doubt that it is spreading widely over much of the United States, and the control measures are not directed really from Washington. They have been left to the discretion of the various governors of the states. So we have very, very different programs in the states and even within states. And so this virus is really spreading widely. I'm afraid the simple matter of wearing masks has become a political issue, if you can think about it. One party wants nothing to do with masks. The other one is advocating masks along with our public health leaders. So we are in a very, very difficult position. And frankly, I anticipate that we will have many more infections, and 150,000 deaths is just profoundly sad, but we will have more, I'm afraid.
Tell me, Dr. Xicheng, about that. Because the world is so much linked, we know virus doesn't reflect any national border. So as long as we have some of the top on the list, such as Brazil, the United States, India, that are really having exponential growth, what does that mean for the other economies in terms of opening border, in terms of cooperation against the virus at a time when anything related to it could become political?
The transparency, communication, coordination is very important. But as I mentioned earlier, if in the U.S. We have no consensus, reaching consensus about how to coordinate efforts at the local level and have national strategy, then it's hard to think about how to make cooperations and make global efforts across countries. With U.S. being traditionally the #1 in Western in the global health. So far, I think in the U.S. There's a huge demand in the coordination for all kinds of things, PPEs, and even in the best scenario, when the vaccine comes in the fall or in the early next year. Whether there could be a plan for the distribution within the country and across countries, that would be very important. And I want to emphasize the keyword coordination, because even with a national plan, how to coordinate efforts across states would be very important. According to our recent empirical study and our colleagues at MIT, there's large spillover of those policies across borders. So we cannot do nothing and in exchange for others to do this public health measures. So every party, every state, every country needs to do their part in order to generate the positive spillover effect. For example, in the U.S., we find if like 1/3 of the neighboring states are doing the shelter at home order, then even if the home states are not doing this, this is equivalent to they are doing this. So we need to generate the positive spillover within the country and across countries.
Right. It is not the first time. It is not the second time. It's not even the 99th time during our discussions at various times, ladies and gentlemen, that we talk about international cooperation and the real significance of it. It's not empty words. It's not political rhetoric. It is real lives we're talking about, Dr. Schaffner. Now, there are things about national, so-called vaccine nationalism that you have seen, that lack of coordination in terms of vaccine research, therapeutic research internationally, that has led to where we are. How do you see, even as scientific research goes on, will it really help the people in need?
Well, I certainly hope so. You know, this started out very, very well, the international cooperation, because the molecular virologists in China established what the genome of the COVID-19 virus was, and then shared that information with the world. And that permitted work on therapy and on vaccines to begin almost immediately. I must say that within our country, I have heard more discussions than ever before that we must pay attention to our global responsibilities, and when vaccines and therapies become available, we must share those. How that will work out, I'm not sure, but there's certainly a sensibility among many people, and certainly my colleagues in public health and clinical medicine wish to share, and equity, not only within our country, but around the world, is really something that we are discussing, and we hope will work out.
There are quite a number of vaccine candidates, of course, around the world. Dr. Tan, when I was talking to the head of the Vaccine Institute, which is based in Seoul, South Korea, they were telling me about all the latest development. But about vaccine nationalism, how does South Korea and a frontline doctor like you look at that issue? And how do you think really things can be resolved so that we can lay down the framework. Once it becomes a reality, the real vaccine, we can get it to the people in real need?
I think we need to determine, who are those people in real need. In other words, we have to establish a priority list in terms of who will be getting the vaccine first when it is available. I think going with what we normally do with seasonal influenza, a modified priority list, makes sense. In other words, healthcare workers should be first in line, and then the people who are at highest risk for developing severe disease and death, that would be the elderly, people with comorbidities. Traditionally with influenza, we're also concerned about the pediatric population and pregnant women. However, with COVID-19, they do not seem to be included in that high-risk population, and also I'm not sure that we've done safety trials in that population, and so they may be a little bit lower on the list in terms of who receives the vaccine within our country once it becomes available. In South Korea, we have phase 2 and 3 trials ongoing for vaccine candidates, and we're also in discussion with different pharmaceutical companies for domestic production of vaccines once we know what works and what's safe. So we're trying. The difficult part about COVID-19 is we are trying to develop a vaccine in parallel with the development of the disease. Yes, we do not know the full spectrum of what we're dealing with, and yet we're trying to prevent this disease from happening in the future. And it's a very difficult situation. But in terms of priority, I think we have a good sense of who should receive it first. Right. It would be the people who are most vulnerable to worse outcomes.
Yes. Dr. Vada, following what Dr. Tan just said, we are trying to do prevention, control, treatment, vaccine, all at the same time. When that virus is spreading around, the disease is getting ever more complicated. So about opening border and about the future platforms of cooperation, there are so many different discussions. What do you think should be the most efficient concerted effort, Dr. Vada?
Yes, the Japan is a kind of island, so the many people are really wanted to prevent from those who are infected are going to come to Japan by airplane or by ship. So has closed the border in March and April, and still we are closing the border, and only a certain number of people can come to Japan. But we also need to consider how we could establish a good system for for allowing people, at least who needs to travel, to come to Japan. And we also are still preparing for the Olympics 2021 in Tokyo. So the government is also discussing how we could set up the effective and efficient system for controlling the disease and also welcoming more people to Japan.
Thank you so much, the four of you. No matter where you are, your contribution to your countries and therefore to the global efforts against COVID-19. Dr. Tan in South Korea, Dr. Vada in Japan, Dr. Schaffner in the United States, and also Dr. Xi Cheng in the US as well. Thank you so much. Thank you. Be well.